Okay. Hi, everyone, and welcome to the kickoff call for the Veteran Oral Health Action Collaborative. I'm Annalise Cothran, and I'm very excited for all of you to join us today as we launch this new initiative in partnership with CareQuest Institute for Oral Health. And Rebecca, can I have you introduce yourself too as our co-presenter?
Yeah, thanks, Annalise. Hi, everyone. I'm Rebecca Matthews. I am Vice President for Health Transformation with CareQuest Institute for Oral Health. Excited to be with you guys today for the kickoff of the Veterans Oral Health Action Collaborative.
Thank you, appreciate it. So today we do have CEUs available. And here are our learning objectives. You'll find the complete CEU information available on our website. Next slide. We don't have any conflicts of interest. And some really brief housekeeping. Number one, the session will be recorded. We will also make it publicly available after on our YouTube channel and linked on our websites. We do intend for this presentation to be interactive. So while didactic presentations and slides are being offered, you can feel free to keep your video camera on or off, totally up to you. And then afterwards, we will stop sharing our screen and we encourage folks to come off of mute and please discuss. Happy Pride. We'd like you to add your personal pronouns to your Zoom name if you are able to do that, and we'll provide CEU information at the end of this presentation. Rebecca, would you like to review this slide?
Sure thing. Thanks, Annalise. Just to give a little background on CareQuest Institute for Oral Health. We're a national nonprofit that really is anchored in advancing a better system of oral health that's accessible, equitable, and integrated. And, that's for everyone. And so I think that's where, as we'll talk today, the partnership we've had with AIDPH over the last years is so meaningful to really put a spotlight on veterans and needs for improving access and equity in oral health for that community. So happy to again be with everyone today. And Annalise, I'll toss it back to you.
Thanks, Rebecca. To give a little bit of background about AIDPH, we're a 501c3 nonprofit dedicated to advancing the science and education of dental public health and our 4 core communities of focus, which include rural, veteran, LGBTQIA, and individuals living with disabilities, which often those 4 core communities intersect. And in particular, AIDPH and CareQuest have taken a dedicated interest in supporting veteran oral health as part of a longstanding collaboration that we've had over the past 2.5 years. You can go to the next slide. Through this collaboration, we've primarily focused on research. When we started a few years ago, we recognized there wasn't a lot of information. And now through this iteration and our continued partnership, we're able to create a learning space like the Veteran Oral Health Action Collaborative, where we can focus on applying that research. Next slide. So this again began in 2021. And we have created multiple publications, which we'll link in the chat for folks who are interested. And those have really created a framework for how we're going to guide our discussion and our interaction and our learning throughout this process. We also have policy and advocacy implications throughout our learnings and partnership together, to include learnings from our Veteran Oral Health Hill Day, which we just had in March of 2023. So we're very excited to take this longitudinal and long-term knowledge and apply it with everyone here today, and also learn more from our community. Again, this is just a sample of some of the resources and publications that we're drawing from in order to create the framework for this learning collaborative. And so now we would like to talk through, when we are discussing the Veteran Oral Health Action Collaborative, what does that really mean? And so what we're basing this on really are elements from MoreCare and an integrated and value-based framework, which Rebecca will dive into in just a minute. But the elements of this critical integration as it comes to supporting veterans and clinical care delivery includes shared responsibility for the oral systemic connection with a robust referral network and treatment planning options where oral health providers and oral health community members and professionals really integrate and pair with other medical professionals in order to create a more integrated environment for transitioning care into an integrated and value-based framework. Hopefully, this ultimately creates an environment of improvement, both for providers and for patients, ultimately veterans in this case. With an underscore here of health information technology, where we'll really be diving into how to use data for informed decision-making that improves patient care delivery. Next slide. And so from this, we have developed this Veteran Oral Health Action Collaborative that includes 4 core components. One, we'll be conducting monthly seminars that are focused on health system transformation and really including those elements of integration into an applied setting. For the second half of these seminars, after a didactic presentation, our intention is to create an interactive and applied learning session through peer-to-peer discussion, guided breakout rooms, and facilitated activities that will help create a personalized learning plan. At the end of that, you'll be able to receive a certificate of excellence for your participation in this program. And ultimately, you'll also be able to have CEU credits through the ADA CERT program should you choose. Next slide. Our intention here between AIDPH and CareQuest through this Veteran Oral Health Action Collaborative is to really increase the knowledge, awareness, and capacity to apply integrated and value-based concepts into this clinical care environment for veterans. We also recognize that veterans are in a healthcare system that is often very different than the rest of the normal population. We're talking about veterans who may be experiencing care within the VA or some forms of primary care within the VA and not others. Veterans who may be experiencing uninsured or partial insurance, who may have family support or not. And so what we really want to understand is how we can create basically a process into more integrated care for those of us working in the private sector, so the non-VA sector, to be able to support a more integrated environment for veterans. And hopefully that's here what we're doing as we go through these seminars, and again, learning from all of you and the care that you're already providing to veterans. Hopefully you will come away with a peer network of clinicians who are inside and outside of oral health that you can find connection with as you continue through your daily lives and your clinical work to help inform an integrated and value-based framework that you can personalize for your care delivery. Next slide. As we've mentioned, we are offering CEUs and a certificate program. So AIDPH awards certificates as part of our educational platform, both in the Rural Echo monthly collaborative that we have, and we are adding this certificate program to show your investment and your competency in veteran oral health care. So we'll share more information about that each month during these seminars, and there'll be more information about it on our website too. Rebecca, can I turn it over to you?
Thank you. You can go to the next slide. So our current system for healthcare for veterans is fragmented, as Annalise just alluded to. And I think a lot of the findings from our research and findings from your own experience, support that. In the last few years of the work that we've done jointly with AIDPH has really helped to highlight the vast inadequacies that exist for dental coverage and access to oral health care needs And what that means, that indicates that we're having poor oral health outcomes across a veteran population. But then too, when we get deeper into what that means at the individual personal level, that represents discomfort, pain, frustration, and understanding and navigating the system, and then also out-of-pocket costs. So there's a lot there that I think we can all a lot we can reflect on that indicates a need not just for improvement, but really to transform the system of oral health care that's available for veterans. And this effort where we can elevate access and coverage and availability of dental needs being addressed, we shouldn't look at it as growing in a silo. It really needs, and I think we'll talk more today about places where bridging that oral health delivery system with the broader medical delivery system is so vital to really in giving the type of health system that we want to see. So that where clinical needs, dental needs are plugged in with clinical needs that can be from medical and behavioral health care teams, as well as connected with community and social supports, so that we're really providing this person-centered approach, a holistic approach to care, which is visualized here, where all of these components can work together in support of an individual's needs, and also what that represents for a population. So by putting the person first and again spotlighting their individual needs, focusing on their satisfaction, on improving their health outcomes, over time, this will ultimately provide a situation for us to better manage costs within the system. So when we talk about improving access, improving quality and outcomes while maintaining or lowering cost, we're really talking about being able to get more value out of the system. So for us, that's where, in improving oral health for veterans, we can't think about it as in a silo. We need to think about it as an integrated approach, and where this effort around medical dental integration is really part of the paradigm shift to value-based care. Next slide. So hearing all that probably sounds good. And I think, maybe we can all nod along and kind of say, yeah, that is what we want to do. But what does it really look like? What does that mean? So this continuum helps to illustrate the move from our current state of, generally speaking, a lack of integration to a highly integrated ideal state that we just talked about with that visual. And so I'll walk you through kind of how to look at this and interpret it. Our current system, our current structure for oral healthcare delivery is not coordinated and is lacking a lot of times, opportunities for referral. The system is bifurcated. We just talked about the silo. And so medical and dental coverage structures remain largely separate. There's not adequate data sharing within our current kind of legacy system. And, measurement, while there is some, emphasis on measurement, it's somewhat limited. And then most places, we still remain heavily in the fee-for-service reimbursement structure. So to move from this current state to a more highly integrated model, we're looking at, I would say, prioritizing a focus on care delivery and coordination, moving into improving opportunities for referral and risk assessment and team-based care as a, kind of a step forward to move into a moderately integrated approach. Those passive referrals become more intentional and bi-directional, where risk assessment is important for capturing information. We're using that to manage disease, and then also working so that individuals within care teams can practice at the top of their licenses. That allows really then that advancement into a more highly integrated system where there's shared responsibility for the care management of individuals across those involved. And so I think here, this is where kind of those ideals of what we can see in integration from the care delivery perspective also are, it's important to look at that in relation to what that can mean for equity too. Moving out of that bifurcated structure to allow for more community engagement and identification of social needs. Then advancing from not just recognizing social needs, but having capacity to help address them physically, socially, or emotionally. And then ultimately, a person-centered and structure that has strong community engagement. So those, kind of ideals for what we can strive for with integration and care delivery and equity, the three categories below that dotted line are more places of like looking at these components as levers or enablers. So where data sharing capabilities can, we need to enhance not just the, self-made processes for sharing data, but system processes that can support interoperability and integrated electronic health records to really ease the process of data being shareable and accessible, where measurement can move from that limited structure to, having more symmetry or alignment in what our goals are for process improvement across an integrated approach, so that practitioners, those care teams that are, co-managing and working together in support of patients, have shared process measure and outcome metrics as goals to ultimately allow them to really focus on outcome-based measurement and where cost and patient satisfaction levels are really the indicators of success. Finally, too, where payment needs to serve as an enabler, our traditional fee-for-service structure is not prioritizing health outcomes. It's not prioritizing the importance of oral health as a contributor to overall health. So advancement in how alternative payment models can support that is something that really needs to go along and serve as a lever to push our integration efforts. So I'll go to the next slide and talk a little bit more about a tool for integration that our More Care framework. Annalise mentioned this earlier. The More Care framework, you can go on to the next slide, is a improvement framework from the CareQuest Institute of Oral Health that we've used for several years that really enables and equips medical and dental care teams to work together to create effort or to improve efforts in integration and coordination of care. So when I say integration of care, that is the emphasis in primary care settings of enhancing a focus on oral health within the medical setting, where primary care teams can take on oral health risk assessments, perhaps preventive service delivery as ways to really enhance their focus on oral health in support of their patients. The coordination of care is to allow for that information that a primary care provider can assess about their patient's oral health needs to really be captured and then available to support referral structures between medical and dental care teams. Next slide. And here's a visual of the driver diagram. I mentioned More Care is an improvement program. And so our main goals, our main aims within More Care to create these interprofessional networks are increasing the rate of dental referrals that can be completed, increasing the patients in our target population with risk assessments documented, as well as self-management goals reviewed and documented. That's that focus on integration within the primary care setting. And then also, if applicable, the percentage of patients receiving fluoride varnish application, typically that's for a pediatric population. So I think here, just kind of focusing on those improvement aims, I wanted to also point back to the secondary drivers listed here and to call out a lot of the themes of where activities can be made at the practice level in increasing oral health risk documentation. in utilizing electronic medical records that support reporting measurement, within medical and dental partners using data to manage shared patient population and documented improvement of health, financial incentives for interprofessional care, and then bidirectional workflows. All of those things are, kind of tools and, part of the continuum slide we talked through a few minutes ago that really point towards where improvement can happen. And I wanted to share this to point out that this is at the practice level, these improvements. But then as we think too, back to that continuum slide, that's an opportunity for the same type of things to be enabled at the system or community level. So as Annalise was talking about earlier, the variety of coverage and care options available for veterans, that's not a limiting factor necessarily for what we're doing, because we can look at this and have some tools that can support our efforts to really improve coordination and improve integration within the systems that we're in. So I think that's where, I hope that we can look at opportunities today and not, the barriers and the disparate private and public infrastructure supporting veteran access to care necessarily let that totally get in our way. All right, next slide. And then finally, I'll just give a quick visual here of what between the medical and dental partners and MoreCare, as they are working in this improvement framework, we have partners work together, a medical care team and a dental care team. You can see the outline within the medical column of tasks that the medical care team takes on to really elevate the focus of oral health in their primary care setting. While on the dental side, there's that emphasis on disease management and risk assessment there. And that's really to help to enable the collection, the collaborative collection of patient information that can be shared across the two entities as they're managing the health of their population and bidirectionally, coordinating referrals to each other. So that is, the improvement program or improvement approach for MoreCare has had that, care delivery angle as a key focus in recognition of the efforts and the need for integration to really be a driver for oral health to be part of value-based care. We also recognize the need for practitioners working in medical dental integration activities to have some exposure to what a value-based payment structure can look like in supporting this type of work and supporting, transformation of care delivery. So we have added recently an optional mechanism within our MoreCare framework to really allow that exposure to what a value-based contract might look like, where data quality and performance against the aims can result in incentivized earnings for providers that are part of MoreCare. Okay, I'll go to the next slide. And so next, just to talk a little bit more about kind of the why, and to set us up more for kind of big picture about what, opportunities integration really will, mean for supporting veteran oral health. I wanted to not, overstress this, but just point out that the relationship of oral health to a number of other chronic conditions or health conditions, there's, significant and growing relational evidence there of the connection. High blood pressure, hypertension, diabetes, obesity, dementia, respiratory health, and adverse health outcome or birth outcomes, excuse me. So in just kind of setting our frame for now and thinking about integration, our focus on oral health isn't just for the dental health of, veterans, is also the connection of their oral health into other, health conditions that they may be experiencing. Next slide. So keeping that in one other point I'll make there of, relation between oral health and chronic conditions. There's also evidence that, continues to build that supports where access to dental services can play a role in improving the health outcomes as well as controlling cost for individuals with chronic conditions such as diabetes or heart disease. So that's a place where, as we in this setting are focused on improving veteran oral health, on the opportunities that integration can bring, in addition to looking at this from an improvement angle, also really emphasizing the value of improving outcomes and controlling costs. Those need to be and stay as main drivers for our pursuit. So in the mindset of improvement, let's talk a little bit more about just baseline. Let's ground ourselves in some of what we know right now. How are veterans accessing dental care presently? There are about 20 million veterans in the US, and of those 9 million are receiving healthcare through the Veterans Healthcare Administration, or VHA. Only 1.5 million are eligible for dental care from the VHA, and just over 500,000 receiving dental care. Next slide. And within the work that AIDPH and CareQuest Institute have taken on in looking at, access to dental services among veterans and non-veterans within, a year, a 12-month time frame, we saw some interesting points. And we just setting that basis of where access to care is and is not, focusing here on veterans with diabetes or heart disease who have had dental visits in the last year. A number of veterans, with those two chronic conditions were having dental visits. But then when we compare that to the rate of edentalism reported, significant or higher rates there among the veterans with diabetes and heart disease. So I think there where, for us to focus on access to oral health care is important, but there is also that need for improved care coordination and management as a component of chronic condition management, and that oral health can play a stronger role there. Next slide. So to dig a little deeper, from veterans with diabetes, we, in looking at these findings, when in controlling for income, education, and rurality, we still saw that veterans with diabetes were 40% more likely to be a dentalist than veterans without diabetes. And then on the next slide, veterans experiencing heart disease were about 30% more likely to be a dentalist than veterans without heart disease. Next slide. So as I turn it back to Annalise, I wanted to just kind of call out those population level indicators of where I think for us some critical opportunity to really not just focus on access to oral health care, but the role that oral health can play in relation to improving overall health access and health outcomes for veterans, particularly those experiencing chronic conditions that are high cost. So Annalise, I'll toss it back to you.
Thanks. I appreciate that, Rebecca. And I hope folks sort of have understood why we developed this collaborative and why all of the research, knowledge, and the frameworks that we've taken together from this point forward have informed why we'll be focusing on an integrated care approach and how we can apply that to veterans. And so, as Rebecca shared with us, we are going to move into how we can apply some of these didactic pieces that we've developed now that you've kind of heard this framework, you've been grounded in what it means. Our intention now is to allow everybody to learn through interaction and discussion. And Stacey, I'm going to pass it over to you.
Okay, great. Thank you, Annalise. And before we move into that part, I actually want to pause for us to take a few minutes to field some questions from folks. So I see in the chat, there's a question from Pam. Where was the data for diabetes and heart disease? Where did that come from? Question from Pam Smith.
I'm happy to jump in there. Thanks, Pam. So the data from diabetes and heart disease, those were part of publications that should be linked earlier in the chat, and some of the research that AIDPH and CareQuest did in order to inform this framework and the path forward. So specifically, those data were pulled from the Behavior Risk Factor Surveillance System dataset, or BRFIS. So those are publicly available data that we analyzed and applied to veteran status. And essentially, even after controlling for all of these extraneous factors, we found that veterans are still more likely to be affected by those chronic disease conditions, which really necessitates an integrated care approach so that oral health is not being treated in a silo, as Rebecca said, and that we're really creating a whole person healthcare approach that reduces both our physical health conditions and our oral health or our oral disease states.
Thanks, Annalise. Other questions? Feel free to pop it in the chat or to raise your virtual hand and come off mute and ask us. And I see Herb's posted in the chat, free screening exams for veterans for anyone within driving distance of St. Louis, I think that should be. Any other questions? And he's clarifying July 8th, I think it's 7 a.m. So any questions about the collaborative, about the action collaborative, or about the information or frameworks that were presented so far? And thanks, Herb, for continuing to post follow-up there. Love the details. Okay, great. So I'm going to keep us going. For those of you who I don't know or don't know me, my name is Stacy Chazen, and I'm Director of Education and Leadership Programs here at AIDPH. And I'm going to take us into the next part of today's webinar. So next slide, please. So we are going to put you into breakout rooms. Part of what we're going to use today's webinar for is to understand what you all are hoping to get out of the Veteran Oral Health Action Collaborative, to get an idea of what you're hoping to learn, what you're hoping to get out of it. And what we're going to do, we're going to put you into breakout rooms. 1/3 of you will actually stay in the main room. That will be your breakout room, so to speak. And you will have a facilitator in your room who will guide a discussion with a series of questions that we will also post in the chat. We're actually going to share it with you in a few ways. And what we're going to ask you to do is your facilitator will lead you through a discussion of the questions. And we're going to ask you each to click on the link that's in the chat for a form into which you can enter your answers to the questions so that we can be collecting your information and use that to inform and finesse our future webinars so that they are as on target as possible with what you were hoping to get out of this program. The link is in the chat right now. It's a Google form that'll take you there. This is just occurring to me, I know some organizations have a block with Google Documents. If that is the case for you, please feel free to write your answers in a separate email, and we will post in the chat where you can email your answers if you have any trouble accessing the form. And then for those of you who do complete the Google form, you will get your answers shared back with you after today. We're going to be in our breakout rooms for 10 minutes, and then we're going to return everyone to the main room. We're going to ask you to come back and share some highlights of your discussion for people to tell others in the full group what some of their answers are, what some of their hopes are for what they'll get out of the Veteran Oral Health Action Collaborative. And then all of this information is ultimately going to be shared back with you when we pull together a summary of what came out of this project and how we're going to be using it to move forward. So next slide, please. Here are the questions, and again, they're pasted in the chat. So we're going to be asking you, how can a value-based care delivery system be used to improve veteran oral health? We're going to ask you to finish the statement. In order for me to fully invest in an integrated or value-based care environment for oral health, I would need blank. Number 3 is brainstorming responses to how can a public entity like the VA work more closely with private practice providers to improve veteran oral health? And then lastly, to finish the statement, if I could learn one thing through this action collaborative, it would be what? So that's what we're going to be doing now. We also ask that when you're in your breakout room, please identify someone, and hopefully that will be a volunteer who can come back and share some highlights of the discussion. And we're going to leave you in your breakout rooms for 10 minutes. So by the time you get there, let's say it's going to be 12:40 Eastern time, and then we will bring you back at 12:50 Eastern time. So as you're going through again the breakout rooms, you're going to be completing the Google form individually. Welcome back, everyone. I hope that your conversations were engaging and valuable to you. I know in our room, we had a few people share out, and I saw a lot of typing into the Google form, so I hope everyone has an opportunity to do that. And we'll ask that if you didn't get a chance to finish it, to please do so by the end of day today while the content is still fresh in your mind, so that we can make sure to get your thoughts, and as I said earlier, to use that information to inform our planning moving forward. But at this point, I would love to turn it over to open up the mic to see, and just switching it up a little bit to what we said at the start, rather than reporting out from your room, although you're still welcome to, would anyone like to share some of their thoughts? Would love to hear what anyone came up with for, in order for me to fully invest in an integrated or value-based care environment for oral health, I would need blank. Would anyone like to share their thought on that? So Ross wrote how to navigate this monumental task. Thank you. Thank you for that. For
Well,
sure.
Stacy, this is Donna.
Hi, Donna.
And I'll say I'm fully invested, but in order for the system to fully invest, there needs to be the payment mechanism there. And until it passes where it's a covered service for veterans through the system, it's a hard sell, because nobody's volunteering, to do it for free or for no compensation. And where I live, dental's not even a valued service, so it's a hard sell to people here anyway. So
Thanks, Donna. And Steve Geierman shared how to successfully engage veterans to advocate for themselves, to get the attention of their elected officials. There are strength in numbers. Thank you for that. And then would anyone like to share their thoughts on, if I could learn one thing through this action collaborative, it would be what?
Hello.
Hello.
Yes. Now I'm just a citizen now, but I used to be in dentistry as a Air Force specialist, and out in civilian life, a Crown or Bridge man. But one thing that I see in the VA is their systems of classification of different individuals who are eligible for dental care. That needs to be upgraded so that there's more care given at the lower end of dentistry than the upper end.
We thank you for that. We have time for one more comment. Does anyone want to share out answers to any of the questions that we posed in the breakouts? Anyone we haven't heard from yet? And I'm echoing Laura McKean posted in the chat and also shared in our breakout room. I'm wanting to learn what other states are doing to engage and promote veterans' oral health for sure. Thanks for that, Laura. Okay, well, again, we implore you, please complete the survey. There's so much rich information that came up across the breakout rooms. I heard from my colleagues in a separate chat that the conversations were really rich and people shared very valuable feedback. So please make sure you complete the form so that we can capture that. And if anything occurs to you after the fact that you want to share, please reach out to us at programs@aidph.org. And Holly shared, I think we need more public announcements in terms of billboards, public service announcements, et cetera. Thank you for that. And Grace just posted the form in the chat as well. So next slide, please. Great, and I'm going to turn it over to Annalise to close us out.
Thanks, Stacy. I appreciate everyone's attention and also investment here today. I really felt like our room discussion went so well, and I'm eager to hear more and read responses from other folks. And we hope that this has given you an understanding of the path forward of how we would like to create, run, and implement this Veteran Oral Health Action Collaborative with all of you. The reality is our intention is to provide a framework for all of you to learn and for us to learn from you. And we hope you'll join us on June 29th for our first really topical seminar on veterans and chronic disease conditions, which, as we pointed out today, veterans are disproportionately affected by chronic disease. And we feel like an integrated framework can really help us create some change and solutions in that area. So we hope you'll join us on June 29th. And then again, starting in July for our next monthly seminar on public-private partnerships in the community care network. So for today, if you participated and would like to have continuing education credits, please fill out the form via the link in the chat. If you do not want continuing education, that is still okay. We would love you to evaluate today's session so that we can use all of your feedback to make this better and stronger and more applicable moving forward. And lastly, if you would like to take a competency quiz for our certificate program, learn more about that on our website. That will also be available after today's session. We appreciate everyone's time and attention. And my thanks to Rebecca too. Rebecca, is there anything you want to say before we close out as our co-presenter?
No, thank you. I'm excited by what I've seen and heard today. I love the energy and I look forward to seeing everyone again in a couple of weeks.
Wonderful. Thank you all and take care.